now. All right, so our final speaker for the morning session, this is again Chaz Emerging Student Scholars. Sierra Sutton's talk is Breaking Barriers, Addressing Racial Barriers to Mental Health Care Access for Black Americans.
Hello, everyone. Thank you for being here today. Again, my name is Sierra Sutton. I am a third-year psychology major, and my faculty mentor is Dr. Aerika Loyd, and my project is called Breaking Barriers, Addressing Racial Barriers to Mental Health Care Access Among Black Americans. So a little bit of background on this topic. Black Americans are disproportionately susceptible to mental health challenges, yet face substantial barriers that prevent them from seeking the help they need. This is caused by generations of racial trauma and systemic healthcare oppression, which therefore increase mental health risk for Black Americans. These issues contribute to increased rates of depression, suicide attempts, PTSD, and other mental health concerns that have become far too common. And despite these challenges, Black Americans, their mental health concerns are often mislabeled as tiredness, and they're often less likely to seek the necessary services compared to their white counterparts. And this is due to various barriers that hinder their use of mental health resources, including structural and attitudinal barriers, which I'll go into a little more detail about right now. So some of the research shows that the following barriers limit Black Americans' use of mental health resources. Some of the structural barriers include financial aspects, geographical distance, comprehension ability, lack of awareness on how to navigate these resources, and lack of representation in the services. Some attitudinal barriers mostly consist of stigma, which prevents seeking and utilization of these services, as also stigma also lies heavily in minority and immigrant cultures. So seeking professional help is often associated with weakness and shame, and many cultures instead depend on community for support. So the lack of education on the severity of mental health issues and the benefits of psychological services also contributes to the avoidance of therapy. And unfortunately, it's found that when Black Americans do engage in professional treatment, their mental health concerns are only exacerbated because they're likely met with microaggressions and culturally insensitive professionals who are unable to meet their specific needs. So in order to deepen our understanding of the causes of these barriers, as well as how to mitigate these barriers, I propose the following study. So based on my preliminary literature review that I just described, I propose the following study to the Chancellor's Research Fellowship titled Understanding the Preventive and Promotive Factors for Accessing Mental Health Care Services Among Black Americans. And this is a study that I'm hoping to conduct in the following school year, and I'll go into a little more detail about right now. So my research questions are as follows. What are the experiences of Black Americans with mental health services? What factors prevent and/or promote Black Americans to seek and utilize mental health services? And what strategies are most effective for reducing the stigma surrounding mental health services, particularly in Black communities? So the overarching purpose of this study is to gain a more authentic understanding of Black people's experiences, thoughts, opinions on mental health services, not just from the literature, not just from trained researchers, but from real everyday people. The methods for my study are as follows. So as I mentioned, Dr. Aerika Loyd is my faculty mentor, and in her lab, the Youth Health and Development Lab, they have an existing study titled, it's a long title, but titled the PACT Project. PACT aims to identify factors contributing to or hindering thriving among Black Americans in the Inland Empire. So since my sophomore year, I've had the opportunity to assist the YHD lab, and I was inspired by the PACT study to build upon the knowledge they've gained and explore these issues in the Black community that are specific to mental health. So although PACT focuses on parenting experiences, cultural socialization, and fears and hopes for their child, I'll be zooming in on the mental health aspect, which is another critical issue in the Black community. So the sample for my study will be participants recruited through the PACT project. The data will be collected through individual semi-structured interviews with Black American parents in the Inland Empire. This will offer insights into their mental health experiences and deepen our understanding regarding what factors prevent and promotes their help-seeking behaviors. So prevent is kind of talking about the barriers and obstacles that prevent them from seeking these services, and promote is talking about the facilitators, like what encourages them to seek and utilize these services. And the goal is to conduct up to 20 30-minute interviews in the fall, this upcoming fall. And I'll go into the timeline a little bit more. For the data analysis, the qualitative data will be analyzed based on the language, behavior, and keywords used by the interviewees. The thematic analysis to identify recurring themes, categories, and patterns. And then the categories will then be collapsed. The themes will then be collapsed into separate categories to address the findings related to the research questions I went over earlier. And again, the semi-structured nature of the interviews will encourage participants to gain more authentic responses and elaborate on what they're going over, their experiences. So some sample questions, these are just a few that I'll be asking the participants. What are your thoughts about mental health services? Can you share any experiences, positive or negative, that have influenced your opinions on professional mental health support? And in your opinion, where is a good place for Black families to access mental health services, such as a child's school, online search, or word of mouth? So the estimated timeline for this project: in the upcoming summer, the YHD lab will submit an application for an IRB amendment to add those sample interview questions to the PACT project, and we'll also begin developing study materials such as, the recruitment flyer, the handbook, training materials, and so on. In the fall, we'll begin recruiting participants for the interviews and conducting these interviews. In the winter, we'll start, analyzing and coding the data, and I'll be working closely with my mentor and the grad students in my lab to coding all of the qualitative data. And in the spring, the data will be finalized, and I'll hopefully be able to present the findings at the same symposium, RPsych, and at least one professional research conference a year from now. And again, this is just a condensed version of the timeline that I submitted with my proposal. There's a little more details in the proposal. So some potential implications for this study, by highlighting the factors that hinder and promote mental health service utilization among Black Americans, it has the potential to discover new culturally adapted practices in mental health resources, has the potential to develop inclusive resources that tailor to the specific demographics in organizations or educational institutions, and also close the racial disparities gap in service utilization and heal the generations of racial trauma caused by these barriers, and as well as increase the understanding in the Black community regarding stigma related to psychological health. So the ultimate goal is that we want the Black community talking about this issue, that mental health is like a big issue, but in order for this to happen, they have to understand it more, and hopefully this study can help with that. So thank you, everyone. This concludes my presentation. I'd like to thank my faculty mentor, Dr. Aerika Loyd, as well as everyone in the Youth Health and Development Lab, the grad students, and my fellow RAs for inspiring this project and providing me with the framework and resources I need, and also being a strong support in my corner. Thank you.